So the Medicaid expansion has been in place now for about 4 years. One of the challenges is that when it was enacted, it was done so without the legislature. So it was done without any plan to pay or sustain it. And when it was first implemented, there was zero cost share for the state. But as that progresses, it goes from 5%, 6%, 7 until we get to 10%. So, a couple years ago, we were budgeting $0 for medical benefits for the expansion population, and now we're budgeting in excess of $300 million, $350 million for this biennium. And so, trying to identify new ways to come up with that is going to be a challenge, especially in light of what was projected to be about a $300 million shortfall. And so, we're looking at ways to, find ways to save money, find ways to deliver products, services more efficiently. Working with our MCOs to provide value-based purchasing, and also, of course, the Medicaid waiver. The Medicaid waiver was one way that we had planned to do all of those things, so decreasing improper ER utilization, increasing people in the workforce, getting people into the workforce will get them off of Medicaid and into private market coverage, which is good for providers because they're getting higher reimbursements. And so we really are optimistic about getting that waiver back in place. It was supposed to take effect July 1st, which is the first day of the biennium, and so every day that passes, we're losing the opportunity to be saving dollars that could help sustain Medicaid expansion. So it's kind of a waiting game at this point, but at this point, we'll continue to monitor, what the costs are, what the shortfall is, and we'll have to make some potentially very tough decisions if we're not able to get the waiver soon. And even with the waiver, we'll still have a challenge with trying to come up with a $300 million general fund shortfall.
So let's start with the waiver. It's currently hung up in the courts, and that brings a lot of uncertainty in a lot of ways. What's going to happen with the expansion, and when we're going to know something. Do you have any idea on timelines? And if it continues down this road and maybe is not approved or is done away with, what happens next? Would the administration completely get rid of the expansion, or what do you expect to see out of that?
Sure. So right now it's at the district court level. It was remanded, vacated and remanded, which means basically that the approval was as if it never happened before. So our application is now still pending with CMS like it was last year prior to approval. They just finished a comment period which they reopened to take into account the judge's ruling. And at this point, we're waiting for CMS to hopefully reapprove the waiver, addressing, of course, those areas that the judge felt were lacking in the approval letter. Hopefully we get that as soon as possible, and we'll be able to re-implement within a few months of that, so that we can start to, again, get the benefits of the waiver, start to really focus on improving outcomes, improving engagement, and of course, as a side effect of that, saving dollars that we desperately need to save in order to sustain it.
So like you said, some tough decisions are probably going to have to be made with waiver or without waiver. Mm-hmm. What do you think those tough decisions are going to look like?
Well, with Medicaid, there's really not a whole lot of mechanisms as far as what drives the budget, right? You have, it's really two things. You have your number of eligibles and the cost of care. And so, with Medicaid, you have to cover certain mandatory populations, and then there's optional populations. With benefits, you have to cover certain benefits, and then there's optional benefits. And so the flexibility that we have, we obviously have to work within the allocation of resources that we have. Within those two are, looking at the eligible populations and looking at the eligible benefits, and each one of those has a price tag. And so whatever the shortfall is, that may be where we have to look, absent an influx of revenue somewhere else, to make up for that shortfall.
So let's shift to the shortfall a little bit. What do you expect that the shortfall is going to be, and how do we pay for that if we don't make some of these tough decisions you're talking about?
So the shortfall right now is projected to be about $300 million, and the way we arrived at that number is we looked at the consensus forecast group's estimate. The consensus forecast group, they are the ones who put together the estimate for the entire state budget, and that's what they used to create the budget. So we took that number, and then we looked at the intervening factors that happened since that occurred, the additional cost. Some things are federal policy changes, some things were state policy changes, and then we look at what the enacted budget is. And so when you look at the enacted budget and you take away those expenditure projections, we're left with about almost a $300 million shortfall. As far as, if we're not able to make benefit or eligibility reductions, then the only other option is to increase revenue. And so that's not something we at the cabinet can do. That's certainly a legislative decision. Hopefully there's new revenue coming in that they could potentially reallocate, or there's other, ways to create new revenue, but it's never an easy process. And, the other challenge is doing it in such a way that provides an immediate revenue. There's things that are being kicked around that are always talked about as potential revenue sources, but sometimes they take constitutional amendments or they require session and then some implementation time. And so we have to deal with the here and now, and the here and now is that we have a pretty significant shortfall and not a whole lot of options of how to deal with it.
So in terms of some of those things that are being kicked around, there's even a new group now talking about changing the healthcare tax system in the state. But there's also other things being talked about, like you said. How serious would this become to the point where it would need to be dealt with in the 2019 session, or could it be dealt with after that?
So the shortfall, I think, has to be dealt with this session. But I think there's also looking long term. What are the long term plans to sustain this program? Because right now I think we're at 6% of state share, but it's going to go to 10% here in a few years. And so the problem is just going to become more acute. And so I think we have to be able to look at all the different tools that are out there. Some of them are administrative tools that we can look at. Again, adjusting benefits or eligibility, improving our MCO contracts to enhance payment and delivery reform. And we are looking at a number of ways, smaller ways that we can try to save dollars. But I think long term we also have to look at if we're going to continue expansion, it was never contemplated how to pay for it because it was never passed through the General Assembly. Typically, when a new initiative would pass like that would have that sort of a revenue impact, it would be passed by the General Assembly and they would allocate resources to that effort. But because of the way this was implemented, that did not occur. And so I think we'll continue to work with the General Assembly, provide information, provide insight, and keep them up to date. Ultimately, if it's a new revenue issue, that's obviously in the purview of the General Assembly to make those appropriations and allocations.
And so last thing on this, in terms of the expansion and the waiver, for people who do feel that uncertainty currently about what's going to happen next and the population itself wondering, am I still going to have my benefits? What do you want to say to them?
I would say just continue to keep an eye on Kentucky Health to see what the impact will be. So we have a website. Go to CHFS's website. There's always information. We put updates there. We have a website specifically for Kentucky Health if you want to find information about that. And we always will provide notice of any changes. So if there's a change that's going to be to their benefits, don't just throw away the mail if you get it. If you see something from the state, take a look and see what it's saying, because we are, as required by law, we're going to provide notices to any changes or reduction in benefits that would occur. Outside of that, we'll continue to put social media and other updates out there to keep people informed.